So once again, aging me and dating me, in terms of how old I am, I remember at the beginning of the HIV epidemic where folks were being put on handfuls of medication. And the medications that they had to take, it was really these specific timing schedules that didn't always match up, and sometimes they didn't work well together. And so Nara, if you could talk some about some of the innovations that we have right now in treating the virus.
You know what? I wish I could announce, that we have a full cure for HIV, but, sad to say we don't, and I wish that, and I'm very hopeful that in my lifetime that there will be a legit, safe way, I know, crossing my fingers, to cure HIV, because I feel like medicine has come so far. And there's just so much innovative and like research and medicine that's coming down the pipeline. And one of the most exciting things that's happening right now is injectable HIV meds, right? So obviously, patients have to be undetectable and they have to kind of medically qualify for it. And, once they get in it, I think they have to take pill medication for a certain amount of time, then they kind of get on it. So there's a whole protocol. But the thought of being able to just come once a month, get a shot in your shoulder, and be on your merry way, you don't have to think about taking a medication every single day, is, so like mind-blowing for me. And even for a lot of, my patients, like there's this thing called pill fatigue. And a lot of the kids that have been taking medication their entire lives, right? That's all they know. By the time they get to teenage age or young adult age, they're just like, I'm so done. Like I'm so done. Like I don't want to take it anymore. And then on top of all of that, I think the frontal lobe, right, which is a decision-making factory of your brain, doesn't fully develop until you're about 23, 24. And so, you're talking to these teenagers that are very concrete thinkers, and to tell them, hey, you have to take this medication every single day so that you won't get sick. Obviously, like when they, they'll test the waters with you, right? And they won't take it for like a month. And then they realize, I feel fine. I'm not sick. I'm not going to the hospital, right? So for them, when they look in the mirror, HIV doesn't look like what it used to look like. So, and you can't just go down the street and pick out people and say, oh, I know you have HIV, or I know you. They look like you and I. We're all just normal people, right? And I think that what they don't know is what's happening to them internally. And sad to say, when you don't take medications for a long time or you're intermittent with it, there are permanent long-term effects on your organs. And you might not feel it now, you might not feel it in 6 months or even a year or two, but it will eventually catch up to you. And, I think in the 10 years that I've been doing this work, thank you, Jesus, I've only had 3 patients of mine pass away. And it's 3 too many. I would have loved to have that be 0. And it's not something, it's a really strenuous, ugly way to pass, because your body just deteriorates little by little by little. And it's really hard to watch, but also I can't even imagine what it feels like go through it, and I think with the innovations that are going on right now, and the fact that we even have injectable medications, is like, I feel like we're that much further along for a cure. And I pray and hope, and I'm gonna cross my fingers again that maybe when I'm 90 years old, there will be a cure, or even earlier than that. I really do hope so.
Yeah. And in the meantime, again, I don't think we can stress enough that until we have a cure, if you think that you have been exposed, it's important to get diagnosed. We can get you on those medications. That's the key to living with this long term. So I know I've said this a few times throughout the videos, but getting tested is such an important piece of living that long, healthy life until we do have a cure.
Right. Well, and I also wonder, and I don't want to get convoluted with this, but does non-compliance with medication lead to resistance as well? Like, can there be some issues there with then the medication not working for you, or you having to take something different? Like, I don't know if there's an impact from that capacity.
Definitely, I think adherence is a big thing, especially, teenagers, you rebel, you don't want to take medications. Also, like, I mean, I'm a grown ass woman. Sorry, my French. And I'm in
And you're in Paris.
And you're in Paris.
I'm in Paris. It's
all
okay.
okay.
But, like, I sometimes forget my vitamins in the morning. Like, if I myself, as a grown woman, forget to take, like, there has to be some grace when it comes to, like, but it's sad to say with HIV medication, you have to be diligent. And I've had kids that were kind of up and down with regimen and with their medication, and they built up a resistance to the medication. So we had to switch their cocktail. We call it a cocktail, right? It's 3 different medications in one. And with that, we have this much HIV medication, right? And every time you get a resistance, it gets shorter and shorter and shorter, right? So the amount of medication that we can put you on, you're burning bridges basically with medications. And I don't want it to come to a point where they've burned so many bridges. I do have a handful of patients, at our clinic right now that are at that point where they could have been on a 1 pill once daily, but because they have so much resistance, right? Their panel just is like all blacked out, right? With different medications, is that now they have to take like 3 pills once daily, 4 pills, once daily, right? Because, and even with that is not the most effective regimen, because only 75% of it is going to work for you, right? And they'll never be able to get to undetectable unless there's new medication that comes down the line. But they've already burned that bridge, and they have to be on this medication now for the rest of their lives. They're only 20 right now, right? You still got until you're 80 or 90, right? And so that part really does scare me.
Is there anything we can do to help folks understand the importance of being diligent with their pills and their meds?
I've been working with teenagers for such a long time. Like, I wish that I had a magic wand, right? Or some sort of like time machine that like I could show them like what it could be. And more than anything else, I think when you have a great team behind you, right, and you get the support that you need, that is the best scenario and position to be in when you're in any kind of diagnosis, right? Not just with HIV, but with other things, right? When you have a team of people, having your back and have your best interests, even if you go through the little, blips here and there, we're here to support you. And hope that, they can get over that teenage hump, and, we haven't lost too many drugs in the interim.
Well, thank you, Nara. This is going to be, I believe, the wrap up of all the videos. If you haven't been watching them in order, please make sure you're going back and watching all of them. And Sarina, any last thoughts?
Just amazing. This has just been very profound, and we will continue to put like resources and other information in the description, because the 15 minutes that YouTube allows us at this point on our channel is just not nearly enough time to talk through these really important issues. But I really appreciate you coming on. I think helping to break the stigma, helping to bring awareness, and hopefully anyone who's watching this video, whether you have a loved one that has a diagnosis, that you have a diagnosis, or whether you just want to get more information, that this has really been helpful and allows you to walk into the rest of the world with more empathy and insight and openness, and to be curious and to know that, there are options. And so thank you so much.